Hello, and thank you for joining us. I'm Sandy Potter, along with Masonicare President and CEO JP Venoit, and Dr. Ronald Schwartz, our Senior Director for Continuum Health Services. We're checking in with you once again as we all work together to help prevent the spread of coronavirus. Dr. Schwartz, last Friday, the FDA gave the green light for a third coronavirus vaccination. This one is from Johnson & Johnson. Many people are curious about the differences amongst these vaccines. Can you give us the breakdown?
Well, I'll certainly try, Sandy. I got to say, this is a monumental time. We were talking before, the show that it's almost been a year since everything has happened. Look where we are now compared to a year ago. We have a third vaccine, to fight this pandemic. I think it's something we should all be, very excited about. So what I'm going to try to do is, hopefully in plain English, is sort of just give you a little bit, again, of an overview of the different vaccines that are available and just some of the differences between them. And I think one of the things that you should be aware of, and this is an important part, is that all of the vaccines, all COVID-19 vaccines, they're inactivated. So what does that mean? That means that they can't hurt you. They can't affect your DNA. They can't make you get an infection. They're inactivated. So if we I'll talk about almost like groups of vaccines. So most of you know Pfizer and Moderna, and these are what you call mRNA vaccines. So they're one class, and I'll kind of compare a lot of the similarities that they have and some differences. So an mRNA vaccine is basically, M stands for messenger. RNA is a fancy word for ribonucleic acid, and it kind of codes for genes. So basically what they're doing is they're trying to code for a gene that's the spike protein on the COVID-19 virus, that basically your body, builds this spike protein from the mRNA, and then you make antibodies to the spike protein. So essentially you're ready. So if you actually do come in contact with the virus, you'll have antibodies already present to fight it off. So I think the other thing to know about both these vaccines, they need to be, in very cold temperatures, stored in very cold temperatures. So Pfizer, and again, you see different data. What I've seen mostly is like minus 70 to minus 90 degrees Fahrenheit, roughly. And Moderna can be more like in a freezer type of situation. But again, they need to be very cold. And both are two-shot vaccines that have been shown to be very efficacious, 94 to 95% of the general population. And they've also seen that both are effective against variant strains that we've heard about in the UK and South Africa. And they have similar side effects, which those of you that have gotten a vaccine would know. The main side effect is soreness of the arm, fatigue. You can get headache or fever as well. But again, we talked about this before. These are generally short-lived, and they're signs that your body is working, building immunity to the virus. So those are positive things. So that's sort of the mRNA virus category. So the Johnson & Johnson vaccine is a slightly different kind of vaccine as a base. It's called a viral vector vaccine. And really what a viral vector is, it takes a modified sort of common virus, in this case, like an adenovirus that causes a common cold, and it's modified so that it can, once again, sort of target and send messages to the cells to produce the spike protein. So both have in common, all these vaccines have in common targeting the spike protein. So once again, you'd build antibodies to the spike protein. And again, if you came in contact with the virus, you'd already have antibodies to fight it off. And again, because the virus is, this Johnson & Johnson vaccine, the virus that they use is modified. Again, it can't infect you. It can't alter your DNA. It can't infect you. So they're safe vaccines is all I'm trying to say. This vaccine's a single dose vaccine. And interestingly, it can be stored at refrigerator temperatures for up to 30 days. So that's an important thing. For efficacy, you see different data, and I've seen the percentage of efficacy in the general population vary. The average I've seen about 72%, but I've seen some data say 66% and some up to 74%. And when they did the studies like the phase 3 trials, they were more limited people age 75 and older. So they're still studying how it affects the older population of people. But this vaccine, again, is highly effective in preventing moderate to severe infection. What they mean by that is it prevents hospitalizations. Like out of 93% of people that get this vaccine, the Johnson & Johnson vaccine, won't need to be hospitalized. And really, of those that were hospitalized, they didn't see any deaths, from COVID-19. So, and just to reemphasize, both the Pfizer and Moderna as well were very, very effective in preventing hospitalized deaths. So they're all very effective vaccines, just a bit different. The other thing that they're saying is that the Johnson & Johnson vaccine may have some efficacy in preventing asymptomatic carrier state. And again, it's also effective, as are the Pfizer and Moderna vaccine in the COVID variant strains in the UK and South Africa. So that's a lot of information to take in. But I think for me, there's really one key point out of all of this that I want to emphasize, and that's get vaccinated. Get vaccinated with whatever vaccine is available whenever it's your turn to get vaccinated. Because the thing to really remember is all these vaccines went through rigorous testing and trials, and different phase trials and phase 3, and were approved by the FDA, not lightly, but through a big panel that really reviewed the data. So they're safe and they're effective. So I'm going to give you one final inspirational quote for the week, which says, "The struggle you are in today is developing the strength you need for tomorrow." And this was actually from an American author named Robert Two. And I think it's a good quote because we have been in a struggle for a long time. And each day we're getting stronger and stronger. And again, this third vaccine is a big breakthrough when you compare where we were a year ago. But again, as we keep moving forward, and we will keep moving forward, we still have to be diligent with wearing our masks and hand washing and social distancing and avoiding large crowds, avoiding travel. And the most important recommendation I can make is get vaccinated. So with that, I thank everybody for their diligence and hard work. And once again, wish you health and peace. Thank you.
Thank you so much, Dr. Schwartz, for all of your insight. And certainly as we are moving forward and vaccinations continue, JP, we're all anxious to have some sort of a timeline for a return to normalcy, if you will. But the reality is that we all play a major part in making that possible.
Sandy, when you look at just the vaccinations in general, here in Connecticut, roughly 22% of all individuals over the age of 16 have been vaccinated so far, which is absolutely amazing. And with Johnson & Johnson coming, that actually will, in my opinion, help get more individuals vaccinated sooner. And that's really important, because ultimately the more people vaccinated here in Connecticut, that allows us the ability to get to some normalcy. Dr. Schwartz talked a little bit about the safety of these vaccines. And I want to add, because there was a recent article from a study done in Israel that actually truly confirmed the data that was first done on the phase 3 trials for Pfizer just a few months ago. So that's telling us that the data is true, it's worked, and the more we get vaccines out there, I think the better it will be for us to get to some normalcy. So Sandy, when we talk about timelines of how we see our opening, we actually are starting to do some of those openings right now. But I will tell you, it's going to be very slow for a whole host of different reasons. One being, we do not want to open too quickly to have to shut down right away or abruptly. And truthfully, I don't want any of our residents or staff to come down with this terrible virus. And that is really important to us. Now, with that being said, the majority of our residents have been vaccinated. a large portion of our employees have been vaccinated, and by the end of June, we expect all of our staff to be vaccinated. So that really will, I think, catalyst us to opening in that time frame to a more normal time, if you will. Now, think about it. Next week will be our, I hate to say this, our 1-year anniversary. March 11th is when the state of Connecticut declared a state of health state of emergency. So March 11th is kind of that day in which there was a lot of change. Now, interestingly enough, we started our task force even before that. We actually are on today, we are on day 360. So in the next 5 days, I think it's on Monday, we will have had our task force start 1 year ago. And our first case was actually 339 days ago. We actually had 2 cases, one at Asher Village and one in our home care. So we've been dealing with this for a very long time. We also recognize that created, obviously, some major challenges. And what we don't want to do is open up and then have something happen. So we have really been working very diligently to develop our opening plans. Now, in our residential communities, we've actually started to loosen up on our dining. Some communities have already started, some are starting in the next week or two. We are looking at visitation, hopefully to start in-person visitation in our nursing home, hopefully to start next week, or quite possibly even sooner. So we are looking at doing some of those openings. Visitation in our residential living communities has just started to loosen up. But I have to say, mask, distancing, still avoiding large gatherings. I know that the state has loosened that up. We still don't want the large gatherings on our campuses for obvious reasons. We have the most vulnerable population that this really has impacted in such a way that we don't want to see this happen again. And next week's our 1-year anniversary, if you will. We want that to be the light of hope that gets us to catalyst us into really the normalcy. And I implore everybody, we're doing good on the vaccinations, over 20%, 22%. We need that number to continue to grow. We need that number to really be at a level that the majority of individuals in the state of Connecticut have gotten the vaccination.
Yeah, it's absolutely, JP. Thank you so much. There's much to be hopeful for and much to look forward to. And we just hope everyone really remembers to stay strong and work together and stay the course, as we've been saying so many times. But it's very important to remember that what we do affects everybody else.
Sandy, I was actually at a Asher Village yesterday, and some of the residents actually came up and said it was so great to see you. And it was vice versa. It was so great to see them. You can't see the smile, but you know there's a smile behind that mask. And that's what we're all about. We want to continue to see that. And I would be remiss if I didn't say thank you to all of our staff for everything that they're doing. And thank you to our residents, patients, and clients for allowing us to serve you and continue to fight to keep you safe. It is truly something that we cherish to be able to do each and every day.
Beautiful words. Thank you, JP. And thank you to both of you for sharing your time with us, as always, and all of this important information. And we thank you for watching at home. Until we see you next week, we hope you'll stay safe and stay well.